Today we are going to talk about types of adverse drug reaction. Types of adverse drug reactions, in this case, type A means augmented, B means bizarre type of reaction, C means chronic, D means delayed type of reaction, E is end of a dose or end of a treatment, and F is a failure of therapy. So these are the various types of adverse drug reaction that we are going to discuss one by one. Okay. Now, pharmacodynamic effect. Pharmacodynamic effect that we have discussed, either it is desired or we can say it's beneficial, or it is undesired, or it's an adverse drug reaction. So we are concentrating on adverse drug reactions. So adverse drug reactions, they are particularly classified into type A. Type A is augmented type of reaction, extension of the pharmacological action of a drug. It is also called as the expected type of reaction, expected type of adverse drug reaction. Type B is a bizarre type of reaction. It is totally unexpected. It's a totally unexpected. So in type A, which is augmented type of reaction, they are further subclassified into side effects, secondary effects, and toxicity. Side effects, secondary effects, and toxicity. And type B reactions are classified into hypersensitivity or allergy, genetically determined adverse effects, idiosyncratic reactions. Okay, so this is the main classification of adverse drug reaction. So what is the main difference between type A and B? The main difference is type A means A for augmented and B for bizarre. A is augmented, so they are predictable. Means we can expect that these adverse effects are going to be there because it is nothing but the extension of pharmacological action, and they are dose dependent. But type B is highly unpredictable. We cannot predict them. The etiology is immunological or genetic, and they are dose independent. They are dose independent, nothing to do with the dose. In type A, high incidence but less severity. Incidence high, frequency is high, but they are less severe. In type B, low incidence but they are more severe. Incidence is very less, 1000 in 1, lakhs in 1, but they are more severe, they are more dangerous, they are more fatal. In this condition, if they are dose dependent, dose reduction is required. Dose required, dose reduction is required. And in type B, they are dose independent. So in that case, we have to discontinue the drug. We have to discontinue the drug. For example, in type A, atropine causes dryness of mouth, blurring of vision, constipation, diarrhea. Right? If you reduce the dose, these side effects will be less because they are dose dependent. In case of this type B, for example, penicillin G causes anaphylactic reaction, which is a life threatening, which is highly unpredictable. We have to stop the drug immediately. We have to stop the drug immediately. Type A reactions, they are related to the pharmacological action of a drug or extension of a principal pharmacological action. It is nothing but the extension of the principal pharmacological action. They are highly predictable. They are highly predictable by preclinical and clinical pharmacological studies. We can easily predict them. They are very common, and that's why they are not serious. They are very common, and that's why they are not serious, and they are usually dose dependent. They are usually dose dependent. And that's why we have to reduce the dose of a drug. We have to reduce the dose of a drug. Then what is meant by side effect? The very commonly used term. Whenever patient goes to the doctor, the first question he asks, is there any side effect of this drug? So what is meant by this side effect? Side effect is unwanted but often unavoidable pharmacodynamic effects that occur at a therapeutic dose. Side effect is based on the same action as a therapeutic effect, desired effect and undesired effect. What is the desired effect of atropine? It is used as a pre-anesthetic medication that will reduces all the secretions. And because of that, it reduces all the secretions. It's a desired effect, but it causes dryness of mouth. That is the undesired effect or adverse effect. That is the undesired effect or adverse effect. Promethazine or any antihistaminic like cetirizine, levocetirizine, it produces sedation, which is unrelated to its anti-allergic action or antihistaminic action. Codeine. Codeine used for the cough produces constipation as a side effect. It produces constipation as a side effect. So we can use this side effect as a therapeutic effect in case of traveler's diarrhea. In traveler's diarrhea, we can use as a codeine. We can use codeine as a drug because it causes constipation. Okay. Now, prazosin. What is prazosin? Prazosin, amlodipine. Prazosin is an alpha blocker, selective alpha blocker. Amlodipine, it's a calcium channel blocker. But both they will cause postural hypotension. Postural hypotension is a side effect, extension of the pharmacological effect of a drug, right? Glyceryl trinitrate, it also causes postural hypotension and throbbing headache because of vasodilatation. Because of vasodilatation, they will produce postural hypotension, throbbing headache, reflex tachycardia, palpitations. These are the extension of the pharmacological effects of a drug. So we can't avoid them. Unwanted, often unavoidable. Unwanted, but often unavoidable. Toxicity of overdose. Whenever if there is overdosing of a drug, ADR caused by excessive pharmacological action of a drug. Excessive. If you have taken a drug at a excessive dose, not at a therapeutic dose. Okay. For example, heparin, it causes excessive bleeding. Because of high dosage of heparin or warfarin, it can cause extensive bleeding. Paracetamol, if it is taken in a higher dose, 10 tablets of paracetamol taken at once, it will form a toxic metabolite, N-acetyl benzoquinoamine. It's a toxic metabolite and it causes hepatotoxicity. Certain drugs, it causes drug poisoning. If you are taken at a higher dose, it causes poisoning, atropine poisoning. Atropine poisoning in the form of delirium, hyperpyrexia, hallucination with overdose of atropine. And what is the antidote for atropine poisoning? Physostigmine is an antidote for atropine poisoning. And all because of the excessive dose or higher dose, or we can say toxicity of overdosing. Secondary effects of a drug. In secondary effects of a drug, it's an indirect consequence of a primary action of a drug. It's an indirect consequence. That's why it's called as a secondary effect. It's a secondary effect of a drug. It's an indirect consequence. Means whenever you have taken any antibiotic, for example, amoxicillin, azithromycin, cephalexin, and it develops diarrhea. Secondary effect. You have taken antibiotic for a upper respiratory tract infection, but you develop diarrhea. That is because of suppression of your gut flora, bacterial gut flora. It will kill your good bacteria and it will lead to the diarrhea. It's a secondary effect of a drug. Corticosteroids, it will weakens your host defense mechanism, immunosuppressant. It will decrease your immunity, and because of that, latent infections get activated like fungal infection, latent tuberculosis, and it's because of the secondary effects. It's all because of the secondary effects of a drug.